Every day we hear a lot of data about COVID, but today there is one number that's had a devastating impact. 27. That's how old Aude Alaskar was when he suddenly lost his life to the virus. The newlywed was at home in Sydney's southwest trying to recover when he collapsed. His is one of two new deaths, along with an elderly woman. Another 233 people in Sydney have tested positive. Only 92 were in isolation while infectious. Let's go live to Tim Swanston in Liverpool. Tim, this is yet another reminder that COVID is a dangerous disease, even for younger adults.
It is, Jeremy. At 27, Aude Alaskar is the youngest person to lose their life in this outbreak. Now, health authorities have said that he wasn't vaccinated against the virus. His family said that he was recovering quite well at home before his health took a sharp and unexpected turn and he died. It's no doubt traumatic for Mr Alaskar's wife. She was with him when he died and she's now recovering here at Liverpool Hospital. Masked, united in grief. This is the scene of this emergency's latest heartache.
I heard the first is crying and then shouting and howling.
27-year-old Aude Alaskar tested positive a fortnight ago. He was isolating at home.
He was being checked daily and he did complain of feeling a little fatigued.
But Mr Alaskar's condition took a rapid turn.
He said that I'm going to go have a shower, guys, and I'll call you back. So he went to the shower and then after that his heart just stopped.
The forklift operator recently married. He and his wife made this their home.
You can imagine the trauma for that other person who is now being hospitalised. That person also had COVID.
A woman in her 80s has also died. In Campbelltown, more than 100 units are under police guard.
Never in a million years would I thought that I would be stuck in an apartment building.
Pauline Tumasanya says some of her neighbours are going without.
I asked one of the police officers that was outside and they said we can't get anything at the moment, not even deliveries.
9 cases have been confirmed in the complex. Officials are pleading with residents everywhere to mask up.
Also sharing lifts with people, minimise your exposure to any common areas.
Aged care homes are also in lockdown. Surveillance testing has caught an infection in a staff member who works here at Stanmore. And in Summer Hill, this cluster has grown to 22.
Now, I'm not going to rule out case numbers won't get worse. I actually think they will get worse.
Less than half of today's cases were isolating while they were sick. 47 were out and about when they were infectious. The movements of the other 73 are still unknown. And the number of potential exposure sites is growing rapidly. About 200 venues have been added to the list. More than a dozen are here in Cabramatta. Extra contact tracers are working around the clock to try to keep up.
We are dealing with one of the most challenging times that we've ever experienced as a nation. And I would ask everyone to do their bit.
Soldiers have joined police on the beat to guarantee that happens. Tim Swanston, ABC News, Sydney.
Alerts have been issued for several regional areas after COVID fragments were found in sewage treatment plants. Nick Hose is live for us in Newcastle. Nick, which areas are authorities particularly concerned about?
Good evening, Jeremy. Look, this really is a community on edge tonight after authorities found traces of COVID-19 in 3 sewage treatment plants, one here in Newcastle, the other in Lake Macquarie, and the third on the mid-north coast at Coffs Harbour. And I think what's most concerning for authorities is that there's no known cases of COVID-19 here in the community. And so that means there's potentially a person or even a number of people who have COVID-19 and could be infectious. Dr. Kerry Chan spoke this morning and she's calling on everybody in the Hunter region to come forward and get a test. Let's take a listen to what she had to say.
It is critical that we can get those testing levels up to really understand as soon as possible whether there is any undiagnosed cases there so that we can make the best public health decisions.
So, Jeremy, this really is a community doing the right thing. Everybody here is wearing masks, they're using QR codes and practising social distancing, but we don't have the same restrictions as Greater Sydney. And even as late as this afternoon, local health authorities were calling for a tightening of restrictions. But whether that's enough to stop a COVID-19 outbreak here in the Hunter, Jeremy, that remains to be seen.
Nick Hose live in Newcastle.